What if the very habit most people are told to do after 60 walking every day is quietly making you weaker instead of safer? It sounds backward because walking has the reputation of being the perfect exercise. It's gentle, low impact, doctor approved, and for millions of older adults, it becomes the main, sometimes the only form of movement they do. And to be clear, walking has real benefits, but here's something that surprised even me after years of working with senior health and movement. A 2019 study from the University of Waterloo found that regular walking activates only about 32% of the gluteus maximus, the largest and most powerful muscle in the body. In other words, nearly two-thirds of a major strength muscle is barely being challenged. Even more surprising, the researchers observed that people who depended on walking alone continued to lose stability and protective strength year after year, even though they were staying active. And what startled scientists most was that the people who believed they were being the most cautious were often the ones losing strength the fastest. Here's why this matters for you right now. The most important exercise we'll show you today is so simple, so basic, and so overlooked that most people never realize what happens when they skip it. Slowly and quietly, that's how balance fades. That's how standing up from a chair starts to feel harder. That's how independence can slip away without a clear moment you can point to. Today we're going to interrupt that pattern. Before we begin, tell us your name and where you're watching from. We have an incredible community here from California to Kansas, Florida to Oregon, and we truly read the comments. Whether you're in your 60s, 70s, or 80 plus, you're not doing this alone. You're part of a group of people who believe aging should feel empowering, not limiting. Drop your name and location below and say hello to someone else in the comments because community is one of the strongest things you can build at any age. In this video, we're revealing 5 essential exercises every adult over 60 should know if you want to stay strong, steady, and independent. These movements are guided by real science designed with joint safety in mind and focused on glute strength, one of the most critical and most neglected areas in senior fitness. We'll count down from number 5 to number 1. And while the first one may seem simple, the final one will be the biggest surprise. Let's start from the ground up, literally. Number 5, step-ups. Think of this as a real-life strength check, one you might not realize you're losing until everyday tasks start feeling harder. Step-ups sound almost too simple. They feel like walking, just with a slightly higher lift. Many people don't even label them as exercise because stepping onto curbs, bus steps, and stairs seems like normal daily movement. But after 60, that one-leg step-up pattern becomes a powerful indicator of practical strength and fall risk. If you're not practicing it on purpose, your body gradually stops doing it well, and you can lose that ability without noticing until your balance starts to feel uncertain. Step-ups challenge the gluteus maximus, gluteus medius, and the stabilizing muscles around your hips and core. These are the muscles that help you climb stairs without gripping the railing, stand up from a low chair with more control, and catch yourself quickly if you stumble. When they aren't used intentionally, they can quietly downshift over time, not with pain, but with a slow loss of stability that can surprise you later. A 2021 study from the University of Florida reported that adults over 60 who practice step-ups just twice a week for 6 weeks improved single-leg strength by 27% and stair climbing stability by 33% without heavy weights or machines. The issue isn't age alone. It's that daily life stops demanding the kind of challenge your body needs to stay prepared. Here's a safer way to do step-ups after 60. Choose a low step or platform about 6 to 10 inches high. Place your entire foot on the step, then drive through the heel as you rise. Avoid jumping and avoid using momentum. Keep a wall or sturdy chair nearby for balance support. Aim for 2 to 3 sets of 8 reps per leg twice per week. And here's the real payoff. Each controlled step-up isn't only exercise. It's a signal to your nervous system that says, I'm still capable. I can still rise. Number 4, glute kickbacks. This is the kind of tiny movement that can make a surprisingly big difference in how you stand, walk, and feel. At first glance, it looks almost too gentle to matter just a small leg lift. That's why many people either skip it completely or rush through it without paying attention. But that small lift can be the line between walking upright and walking with nagging aches. Here's the reason. With age, one of the earliest functions many people lose is clean hip extension without borrowing power from the lower back. When the glutes stop doing their job, the body starts compensating. Hip flexors tighten hamstrings over work, and the lower back takes on strain it was never designed to handle. Glute kickbacks are meant to reteach the nervous system what should switch on first. They train your brain to recruit the gluteus maximus before everything else. And that matters because the gluteus maximus is your main engine for walking, climbing stairs, rising from a chair, and staying stable. When it's asleep, the rest of the body has to work harder just to get you through normal movement. A study published in the Journal of Geriatric Physical Therapy reported that focused glute activation, including kickbacks, improved hip extension control, walking confidence and balance in adults over 65 in only 4 weeks. No gym, no machines, no heavy weights, just precise intentional movement. Here's how to do glute kickbacks safely at home. Stand behind a sturdy chair or a countertop and hold it lightly for balance. Keep your spine tall. Lift one leg straight back behind you, but don't arch your lower back. The movement should come from the glute, not the spine. Pause at the top for 1 to 2 seconds, squeeze, then return with control. Do 10 to 12 reps per leg for 2 to 3 sets. This is not about lifting your leg high. It's about building a clean connection to the right muscle. Done consistently, glute kickbacks can help rebuild strength, improve posture, and bring back confidence one small, focused lift at a time. Number 3, glute bridge. The strongest exercise you can do while lying down. I hear this all the time from older adults. If I'm on the floor, it doesn't feel like real exercise. We've been trained to think movement only works if it's fast, sweaty, or complicated. But the truth is quieter than that. One of the most effective strength builders for your hips, spine, support, and posture can be done flat on the ground. It's called the glute bridge, and it isn't just for athletes. It's for anyone over 60 who wants to stand taller, ease back, discomfort, and move with more control. Here's why it matters so much. With age, many people lose the ability to switch on the glutes without borrowing from the lower back. The brain gradually loses the right activation sequence, and the body starts relying on the spine or the hamstrings to do a job the glutes were designed to handle. The glute bridge rebuilds that connection. Done correctly, it strengthens the gluteus, maximus reinforces the posterior chain to support better posture, and teaches your body to lift through the hips instead of straining through the spine. A clinical trial published in the Journal of Orthopedic and Sports Physical Therapy followed adults over 55 who added glute bridges into their routine. After 8 weeks, they reported a 42% drop in chronic lower back pain and a 35% improvement in mobility scores. No medication, no surgery, just consistent focused movement. Here's a safe way to do the glute bridge at home. Lie on a mat or firm surface. Bend your knees and place your feet flat, about hip width apart. Let your arms rest by your sides, brace gently, squeeze your glutes, and lift your hips only until you form a straight line from shoulders to knees. Keep your lower back from arching. Pause at the top for 2 to 3 seconds, squeeze, then lower slowly with control. Do 12 to 15 repetitions for 2 to 3 sets. Optional tip: place a pillow or yoga block between your knees to help keep alignment and recruit more stabilizer muscles. It may look gentle, but this movement trains your body to support itself from the ground up. Number 2, seated band abductions. The quiet muscle group that protects your steps. It sounds almost too simple, sitting down and pressing your knees outward. How much could that possibly matter? A lot more than most people ever expect. This small-looking movement is one of the most effective tools for improving hip stability, protecting the knees, and reducing fall risk after 60. It targets the side glutes, especially the gluteus medius and gluteus minimus muscles that rarely get attention but make a huge difference in real life. These side glutes don't get the spotlight like the larger glutes do, yet they work every time you stand on one leg, shift your weight, step off a curb, or catch yourself after a stumble. When they weaken, which often happens with aging too much, sitting, or simply not training them, Your body starts to sway side to side as you walk. That sideways wobble can start out subtle, but it gradually pulls the knees out of alignment, adds stress to the lower back, and increases the likelihood of a fall. A study published in the Aging and Balance Journal reported that hip abduction, strength, the ability to press the knees outward, was the strongest predictor of fall recovery success in adults over 65. Think about that. Not reaction time, not eyesight, not even walking speed. The strength of these invisible side glutes mattered most. Here's how to do seated band abductions safely at home. Sit tall on a firm chair with both feet flat on the floor. Place a light resistance band just above your knees. Keep your knees bent and about hip width apart. Slowly press your knees outward while keeping your feet planted. Pause at the widest point for 1 to 2 seconds, then return slowly with control. Do 12 to 15 repetitions for up to 3 sets. And here's a simple tip. The slower you move, the more your glutes have to work and the more control you rebuild. It may not look dramatic, but every outward press strengthens the muscles that help you stay upright, steady, and strong. Number 1, Bulgarian split squat. The most overlooked strength builder for adults over 60. When people first hear Bulgarian split squat, the reaction is almost always the same. That sounds way too advanced for someone my age. And that makes sense. The name feels like it belongs in an Olympic training facility, not in a simple at-home routine for older adults. But here's the reality. This is one of the most powerful practical glute strength exercises many adults over 60 are never shown, and skipping it can quietly cost you more than you realize. What makes this movement different is how much it trains at once. It forces the gluteus maximus and gluteus medius to activate strongly, while also challenging balance core stability and proprioception. Your body's ability to sense position and control in space. That combination translates directly into real-life, steadier stair control, better recovery if you trip, and a more even confident stride. Most exercises keep you evenly planted on 2 feet, but daily life doesn't. Walking, pivoting, reaching, stepping off a curb, all of it demands single-leg stability. And when we avoid that challenge because it feels difficult, we never give the body a chance to rebuild what it's slowly losing. According to Dr. Andrew Lakash, a physical therapist who specializes in older adults, the Bulgarian split squat is one of the most effective ways to restore symmetry, improve gait, and rebuild hip strength in seniors. In clinical settings, it has been used to address pelvic instability, improve walking mechanics, and in some cases even reduce dependence on canes or walkers. The biggest risk isn't the exercise itself. The real danger is avoiding it completely. When one leg becomes weaker, you unconsciously shift more weight to the stronger side. Over time, that overloads one knee or hip, creates a growing imbalance, and can lead to compensation injuries and long-term pain. Here's a safe at-home version. Stand roughly 2 feet in front of a sturdy chair or low bench. Place the top of 1 foot behind you on the chair. Keep a wall or another chair nearby so you can lightly hold on for support. Slowly bend your front knee and lower only to a depth that feels comfortable. Keep your chest tall and don't let the front knee drift inward. Then press through your front heel to rise back up to standing. Begin with 6 to 8 repetitions per leg. Do 2 to 3 sets using body weight only. Modification tip. If balance feels uncertain, shorten the range and rely on support. Smooth control matters more than going deep. I've watched this movement change what older adults believe is possible. One woman in her late 60s had avoided stairs for years. She started with a modified split squat. Within 8 weeks, she was climbing a full flight without holding the railing. She didn't just rebuild strength, she rebuilt trust in her own body. And that's the real goal here. Not trying to be young again, but getting your strength back so you can keep being you. Modern medicine can do amazing things, but it isn't a complete answer, and after 60 more isn't always better. You don't need marathons, you don't need heavy lifting, and you don't need to compete with 20-year-olds at the gym. Because the truth is, at this stage, your body doesn't reward intensity the way people think. It rewards consistency. This isn't about doing everything, it's about doing what matters most. What matters is strength that supports real life, standing up from a chair without pushing off with your arms, walking steady on uneven ground, catching yourself when you slip, and staying upright. Your glutes aren't just posture muscles. They aren't only about power, they're about independence. And that independence returns when you wake up the muscles your body has forgotten in ways that are safe, smart, and suited to this season of life. So, the next time someone says, just go for a walk, you'll understand the fuller picture. Walking is valuable, but it's only the starting line. Real prevention doesn't begin in a clinic. It begins when you reconnect with your body and choose movements that rebuild confidence, not just movement. So before you chase the next test treatment or trendy workout, ask yourself what happens if this doesn't work. Then remember this, you already have the tools. You already have the wisdom. Now you only need the movement to match it. As we close today, I want you to remember one thing. Strength after 60 isn't about proving anything to anyone. It's about protecting your freedom. It's the ability to stand up without hesitation, to walk across uneven ground, without fear to catch yourself and stay steady when life surprises you. That kind of strength doesn't come from chasing intensity. It comes from small, smart movements done consistently until your body starts to trust itself again. So don't let just go for a walk be the end of your plan. Walking is a beautiful start, but real prevention is built when you train the muscles that keep you upright, balanced, and independent. Choose one movement from today. Do it gently. Do it regularly. And watch how quickly your confidence begins to return. If this video helped you, please tap the like button, subscribe to the channel, and turn on the notification bell so you don't miss the next video. We're sharing simple science-backed exercises that keep adults over 60 strong, steady, and safe without pain and without complicated routines. Thank you for watching, take good care of your body, and I'll see you in the next video.